about 3 years in the global surgery academic circuit, trying to understand and trying to really think, how can we make a huge difference, a dent? The problem is so massive. And it was really out of frustration. I just I wrote some papers, they didn't really do anything. And waiting for something to change, I just said, all right, why don't I just stop speaking, pick up the camera, and just show people what's going on. Let the patients speak. Let the providers on the ground just tell their story. So the Right to Heal was born from that frustration, really. And I just asked around and said, do you know someone? And yes, obviously people knew people who had this kind of problem. And we went around and did, one country to the next. Before we knew it was 7 countries. I used the Cine Verite style of documentation where I was on the ground, I was open, and I let them educate me. And it was really their voice that informed the film and created the film. It was, I was just merely a conduit for it. The result was massive. When we showed it to everybody, the response was always, how can I help? What can I do? And it opened up so many doors and really brought home the point that what we're talking about here is the neglected surgical patient. And you, like a person who's been in public health, only thinking about infectious diseases, then kind of just started to have a grasp of what do we mean by surgery in public health. And we used that film to advocate and say, let's push for a formalization of doing something for these people, meaning what about a resolution for surgery? And so it really paved the way for a lot of, at least a lot of effort in terms of moving in the right direction for surgery.